So we are going to move on from talking about psychotropic medications and talk about another biomedical treatment for mental disorders. And it's electroconvulsive therapy, or ECT, and this will be pages 581 to 584. So while millions of prescriptions are written for antidepressant medications in the US every year, there are a small number of patients who receive electroconvulsive therapy, or ECT. And ECT is a biomedical therapy, and it's used primarily to treat major depressive disorder. And it involves electrically inducing a brief brain seizure. You might have heard this referred to as electroshock therapy. So ECT is actually a relatively simple and quick medical procedure. It's done in a hospital. The patient lays on the table, electrodes are placed on one or both of the patient's temples, and then the patient is given a short-term light anesthetic and muscle relaxing drugs. Sometimes they'll place a breathing tube just to make sure that there's adequate airflow. So while the patient is unconscious, a split-second burst of electricity induces a brief seizure. Now, outwardly to the people in the room, the seizure looks like just mild muscle tremors. So once the anesthesia wears off and the patient wakes up, it's completely possible for the person to have a lot of confusion and disorientation for a few hours. Some patients will experience temporary or perhaps permanent memory loss for the events leading up to the treatment. One of the patients that I worked with who received ECT would talk about how she would get up in the morning, she'd, get showered, get dressed, eat breakfast, and then she would go have her treatment. She would remember none of that. She'd remember going to bed the night before, and then she would remember waking up in the hospital after having her ECT. And she would never remember the events of the day. She would never remember what she had done that morning, right up until she went and had the ECT, and then she was fine in terms of her memory for the rest of the day. That was how her brain functioned with the ECT. So when treating major depressive disorder, typically the patient will get 2 to 3 treatments a week for 2 to 7 weeks, and then less frequent follow-up treatments for several additional months following all of that. So effectiveness. In the short term, ECT is effective for severe cases of major depressive disorder, and about 80% of patients improve. A good benefit, ECT actually can relieve symptoms quickly, typically within days. So ECT is not a first line of defense. It's not the first thing that anyone would do. It usually is only offered after other forms of treatment, including psychotherapy and psychotropic medications, have already failed to help the patient, especially when the depressive symptoms are severe. Now, they've also discovered that for some people, the elderly is a good example, ECT could actually be less dangerous than giving them antidepressant medications. And in general, the complications are pretty low. There's no evidence that there's any brain damage that occurs after a person has received ECT, and there have been extensive studies on this. But with all of that, inducing a brain seizure is not something to be taken lightly. There are potential dangers and drawbacks. So one of the things is there's serious cognitive impairments can occur. For example, excessive amnesia or disturbances in language or verbal abilities. And ECT's biggest drawback is that its antidepressive effects can be short-lived. Relapses within 4 months are actually relatively common. And if you look 6 months out, about half the patients treated for major depressive disorder experience a relapse within 6 months. Now, typically the patients are treated with long-term antidepressant medication following the ECT, which can help reduce that relapse rate. In severe recurring cases of major depressive disorder, ECT can also be periodically readministered to prevent the return of depressive symptoms. So why isn't it more commonly used? Well, it's still considered very controversial. You're delivering a shock to a person's brain. Of course it's controversial. And there's also a lot of people question the safety and effectiveness of ECT. But regardless of all of that, it's actually still available in most major metropolitan areas of the United States. There are plenty of doctors who will prescribe it and plenty of hospitals that will administer it. So when we talk about how ECT works, despite decades of research, they still don't know exactly why electrically inducing a convulsion relieves the symptoms of major depressive disorder. Now, one theory is that ECT seizures could somehow reboot the brain by depleting and then replacing important neurotransmitters. Think about it like your computer. If your computer's malfunctioning, sometimes a little reboot is all it needs to then keep going. So people have made that connection with the human brain as well, that perhaps ECT gives it that reboot it needs. Now, there are also some new experimental treatments that suggest that those seizures, the seizures that are done through ECT, might not actually be necessary. It might be possible to provide lower levels of electrical current to the brain and still reduce those severe symptoms. So the first one we're going to talk about is transcranial direct current stimulation. It's similar to ECT, but it uses a small fraction of the electricity. There's also transcranial magnetic stimulation, and instead of electricity, this actually involves the stimulation of certain regions of the brain with magnetic pulses of various frequencies. Neither of these two require any anesthetic. They induce no seizures, and they can be conducted right in a doctor's office instead of in a hospital. So the next one is vagus nerve stimulation. So while the first two we've just talked about are things that you would go to an appointment to the doctor to receive, you would go periodically, these next two are things that would be permanently with you. So the VNS is another experimental treatment. It involves a surgical implantation of a device that's about the size of a pacemaker into the left chest wall. The device provides brief and intermittent electrical stimulation to the left vagus nerve, and the vagus nerve runs from the neck and connects up to the brainstem. They don't know exactly why this works, but it appears to help treat depression. There is also something called deep brain stimulation, and it uses electrodes that are surgically implanted in the brain and then a battery-powered neurostimulator that gets surgically implanted into the chest. Wires are then run under the skin to connect the two implants, and then the neurostimulator sends electrical messages to the brain. These are all still considered to be experimental, and some of the research findings are mixed. But like ECT, the specific mechanisms by which they work is still not known. Researchers are hopeful that these techniques will give some other viable treatments, especially for major depressive disorder, and they may help people suffering severe psychological symptoms and may actually help reduce things like suicide rates or inpatient hospitalizations.